why are we so bothered about this kind of diabetes? Because this kind of a diabetes can affect your baby, it can affect you as well. So how does it affect your baby? Because it's always a precious baby. So how does it affect your baby? The baby may get excessive weight, become bigger, chubbier. Because it becomes bigger and chubbier, there may be difficulty in delivering it. So hence may end up with a increased number of section deliveries, may end up little more tears, sometimes including back passage tears and things like that, which has to be repaired properly, and also requiring forceps and instrumental deliveries, sometimes even difficult ones, and rarely also shoulder dystocia. The shoulder dystocia means baby's shoulders get stuck behind the bones, hence it becomes difficult to deliver the baby. We'll talk about shoulder dystocia in another talk. But the other thing is, sometimes when the pregnancy is not going so well because of diabetes, we may deliver the baby very early on. That's another problem. Serious breathing difficulties are more so in these babies than the other babies. Babies used to high blood sugars with mother, so what happens is when it comes out, the sugars might become very low. That's why if you are diabetic, your baby will be pricked few times after birth regularly to keep an eye on baby's blood sugar. Later on in life also, little one has got an increased risk of becoming obese as well as diabetic. This is the case even if the baby is small because of diabetes. Sometimes the baby can become very small if the diabetes is affecting you in a different way, not just a big baby on the other side. And also increased risk of stillbirth in this kind of a pregnancy. So these are all the things for the baby. So how does it affect you? As I said, delivery can become complicated because of bigger baby, so hence instrumental deliveries, surgical like resection, and once this diabetes, although the diabetes goes away after you deliver, your risk of having diabetes later on in life is increased because of this. What do we do about it? I will explain to you in a minute. And also this increases your risk of having blood pressure problems in pregnancy and preeclampsia. Remember I told you baby can become very small as well. So if you're affected with one of these things, then the baby, although you're diabetic, can be a small baby. So that's how we say big baby, but a very immature baby. So now that we know the importance of why we should diagnose pregnancy with diabetes, so what are the risks? Why do people get it? As I had listed earlier, those are all the risk factors.